Welcome back to Therapy Thursdays. We are Physical Therapy and Balance Centers. I'm Angela Yarborough. And this is Dr. Jerry Yarborough. And last week we were talking about golfing and some injuries or some things that you need to know as golfers. So tell us, what kind of injuries can happen while you're golfing?
Right. So if you remember last week, Angela thought golfing was too leisure to
You had to bring that up, didn't you? You just had to bring that up.
Yeah, I just want to remind you guys of that. But actually, golfing is very physical and can lead to many impairments. If you don't follow that SMART acronym we talked about last week, if your muscles are real tight and you're not ready to start performing, you can definitely have lots of injuries. With the movement that golfers make and the twisting that they make, they can have a number of injuries, all the way from their feet on up. Ankle injuries, knee injuries, low back injuries are very common. But you can also have shoulder injuries, elbow injuries, wrist injuries, and even neck injuries. I'm pretty stiff, so whenever I was practicing to try to learn how to play golf, really my neck really told off on how stiff it was. So golfing is a total body activity. The impairment that we're talking about today specifically is going to be called golfer's elbow. Now it's called golfer's elbow because many people that play golf get it, but there's so many different activities that can actually cause golfing elbow. And it's right here. So if you have tenderness on that medial bone of your elbow right there, that's what golfer's elbow is. And it's actually caused from a repetitive use, okay? And improper muscle preparedness. So again, it's very important that we work on the flexibility and the strength and proper form and everything else to prevent injury to our elbow. And so like I said, we're going to specifically talk about that. It is the muscles of the forearm that actually do wrist flexion that attach to a common tendon here called the common flexor tendon, which for those that don't know, muscles attach to the tendon, which then attach to the bone. And it can get really tight and inflamed and cause you a lot of grief there. Again, it's repetitive use. So people like if you're shoveling a lot, many of us don't do that regularly. So if we get out there and do things like the weekend warrior, you're not used to that. Hammering, so a lot of construction guys can get golfer's elbow. Of course, golfing can cause that. Anything which you're putting a lot of stress on those flexors, it'll get really tight. It can cause multiple micro traumas in there, and that tendon will actually become fibrous or very stiff with a lot of scar tissue even. So, through a thorough evaluation by your primary care provider or your physical therapist, we can determine exactly what's going on. Now, physical therapists are going to treat it not with medicine or injections or surgery. We're going to treat it conservatively and teach you the RICE method of rest, ice, compression. Instead of elevation, it's exercise. So come back in the next segment and we're going to get more into that.